Accessories digestive organ. Salivary glands secrete saliva containing for starch digestions. Liver produce bile which helps digest fat. Gallbladder stores and releases bile into the small intestine. Pancreas secrete digestive enzymes, amylase, lipase, trypsin, and bicarbonate to neutralize acid. Teeth and tongue aid in chewing and mixing food with saliva. Anatomy of salivary gland. Salivary glands are exocrine glands that secrete saliva into the oral cavity. The, they play a key role of indigestions, lubrications, oral hygiene, and taste. There are three major pairs of salivary glands and numerous minor glands throughout the mouth. Major salivary glands, parotid glands. It is the largest salivary glands located in front and below the ear, extending to the mandibular rams. Duct, that is Insenson's duct, open opposite the second upper molar. Secretions, serous, that is Whitey and Jaime Rich. Submandibular glands located beneath the lower jaw along the body of the mandible. Duct, Vertron's duct, opens at the floor of the mouth near the lingual frenulum. Secretions, mixed serous and mucus, more viscous than parotid. Sublingual glands, smallest of the major glands located under the tongue. Duct, Bartholin's ducts open along sublingual folds. Secretions mostly mucus, very viscous. Minor salivary glands, hundred of small glands in lips, cheeks, palate, tongue, mostly mucus secretions contribute 10% of total saliva. Histology composed of acini, secretory units and ducts. Serous acini, watery enzyme rich saliva. Mucus acini, thick mucus rich saliva. Myoepithelial cells around acini help expel saliva. So this is the structures. This is parotid duct, opening of submandibular Vertron's duct, sublingual gland, submandibular Vertron's ducts. This is submandibular gland, body of mandible, parotid gland, and accessories parotid gland. Physiology of salivary gland. Saliva productions volume 1 to 1.5 liters per day in adults. Composition: water 99%, hydrate oral cavity, dissolve food, electrolyte sodium, potassium, chlorine, and bicarbonate, that is buffer pH. Enzyme salivary amylase, ptyalin, digest starch, mucus, lubricant food, antimicrobial substance, lysozyme IgA. Function, that is digestion, begins starch digestions, lubrications, moisten food form bolus, protections, washes oral cavity, antibacterial actions, buffering, maintain pH 6.5 to 7.5, test dissolve food for fast receptor, for test receptor. Regulation of saliva secretions, autonomic nervous system, parasympathetic vagus and facial nerves stimulate watery enzyme rich saliva. Sympathetic, that is T1, thoracic 1, thoracic 3 spinal nerves stimulate thicker mucus rich saliva. Reflex stimuli, that is sight, smell, taste, or even though of food. Clinical significance: xerostomia, dry mouth due to reduced saliva because of medication, dehydrations, nerve damage. Cellulitis, salivary stone blocking ducts. Infections, for example, mumps, parotid gland inflammations. Salivary gland tumors, begin or benign or malignant growths. Anatomy and physiology of the liver. The liver is the largest gland and one of the most vital organs in the human body. It performs metabolic secretions and storage functions that are essential for life. It is both a digestive gland, produce bile, and a metabolic organ. Location lies in right upper quadrant of the abdominal cavity, located just below the diaphragm, mostly under the right rib cage. The right lobe is much larger than left. Shape and size: wedge shaped reddish brown organ, weight about 1.2 to 1.5 kilogram in an adult. Soft but firm due to connective tissue converting, that is Glassen's capsule. Lobes of the liver. The liver is divided into four lobes: right lobe largest, left lobe, caudate lobes, quadrant lobes. So this is the structures. That is anterior view, that is falciform ligament, right lobe, left lobe, this is gallbladder. Posterior view, that is porta hepatis. Another is caudate lobe, fissure of teres ligament, and then another is proper hepatic arteries, teres ligament. This is aorta. This one is inferior vena cava. This is gallbladder. This is portal vein. This is common bile duct. It is right triangular ligaments, caudate process, and hepatic veins. Surface: diaphragmatic surface, smooth, convex, faces upward. Visceral surface, faces downward and backward, contain impressions of stomach, gallbladder, and intestine. Ligaments: the liver is held in place by, that is, peritoneal ligaments, including falciform ligaments, attach liver to anterior abdominal wall. Round ligament, ligamentum teres, remnant of fetal umbilical vein. Coronary and triangular ligaments attach liver to diaphragm. So this is another structures. This is falciform ligament, left triangular ligament, right triangular ligament, right lobe, left lobe. This is the gallbladder. Cystic duct. This is cystic duct. Common hepatic duct. Then that is quadrant lobes. Another is proper hepatic artery, portal veins. So blood supply: the liver has a dual blood supply. Hepatic artery supplies oxygenated blood. Portal vein, 75%, brings nutrient rich blood from the intestine. Venous drainage: blood leaves through hepatic veins, drains into the inferior vena cava. So this is the blood supply of the liver. This is vein, inferior vena cava, aorta, hepatic artery, portal vein, gallbladder, common bile ducts. Bile duct system: right and left hepatic ducts from respective lobes. Unit to form common hepatic ducts. Join cystic duct from gallbladder from common bile duct, open into the duodenum. So this is the right lobe, coronary ligament, left lobe, falciform ligament, ligamentum teres. This is gallbladder. So this is liver right lobe, esophagus, liver left lobe, then that is falciform ligament, that is another is, this is the area, this is the portion of stomach, common hepatic duct, that is pancreatic duct, that is common bile duct, this is duodenum, This area is the duodenum. Another is, this is the pancreas, that is gallbladder. Another is cystic duct. This is the right and left hepatic duct. Microscopic structure. The liver is made of tiny hexagonal unit called hepatic lobules. Each lobule contain central veins in the center, hepatocytes, liver cells arranged in platelets, sinusoids, blood channels between the cell platelets, Cooper cells, macrophages that remove debris and bacteria. So this is the microscopic structures of liver. So this one is bile duct, this is hepatic artery, this one is branch of portal vein, this is branch of hepatic artery, this is bile duct, sinusoids, this is hepatocytes, liver cell, that is bile canalculus, then central veins and hepatocytes, that is liver cells. Physiology of the liver. The liver performs more than 500 vital functions, but the key ones are grouped below. Digestive functions: secrete biles 800 to 1000 ml per day, bile compositions, bile salt, bile pigment, bilirubin, cholesterol, water and electrolytes. Function of bile: emulsified fats, break fat globules into smaller droplets, helps in absorptions of fat soluble vitamin A, D, E, K, excrete bilirubin, a waste product from RBC breakdown. Metabolic functions: carbohydrate metabolisms, convert glucose, glycogen, that is glycogenesis, convert glycogen to glucose when needed, that is glycogenolysis, convert non-carbohydrate to glucose, that is gluconeogenesis, maintain blood glucose level. Protein metabolism: synthesize plasma protein, that is albumin, fibrinogen, clotting factors, convert ammonia into the urea for excretion, synthesis and break down amino acids. Fat metabolism: synthesis cholesterol and phospholipids, convert excess carbohydrate and protein into fatty acid, break down fats for energy. Detoxifications: detoxified drugs, alcohol and toxin, convert ammonia to urea, that is less toxic, break down old hormone and bilirubin. Storage functions: store glycogen, iron, copper and vitamin A, D, E, K and B12. Hematological functions: in fetus produce RBCs before bone marrow develops. In adult, destroys worn out RBCs and WBCs through Cooper cells. Hormonal and immune functions: Cooper cells remove bacteria and antigens from bloods. Participates in the metabolisms of hormones, insulin, estrogens, etc. Clinical significance: jaundice, yellowing due to excess bilirubin, hepatitis, inflammation of the liver, viral or toxic, cirrhosis, liver scarring due to chronic damage, fatty livers, fat accumulations from alcohol or metabolic disorders. Anatomy and physiology of the gallbladder. The gallbladder is a small pear-shaped accessory digestive organ that store and concentrate bile produced by the liver. It plays vital roles in fat digestion by releasing bile into the small intestine when needed. Location: lies on undersurface of the right lobe of the liver in a shallow fossa. Position: in the right upper quadrant of the abdomen. Connected to the bile duct system that opens into the duodenum. Shape and size: pear-shaped sac about 7 to 10 cm long and 3 cm wide. Capacity 30 to 50 ml of bile. Parts of the gallbladder: fundus, rounded and that projects below the liver margin. Body main central portion. Neck narrow portion that continues as the cystic ducts. So this is fundus, body and neck. Duct system. Cystic ducts from gallbladder joins the common hepatic ducts from liver to form the common bile ducts. The common bile ducts open into the duodenum at the ampulla of Vater along with the pancreatic duct. So this is fundus, this is body, this one is neck, this is cystic duct, this is right and left hepatic duct. Then after that this is common hepatic duct, this one is common bile duct. Then after that this one is spiral valve. Wall structures. The wall of the gallbladders has three main layers: mucosa, inner lining with fold to allow the expansion, secretions, mucus, muscular layers, smooth muscles, contacts to expel bile, serosa, outer covering, visceral peritoneum, blood supply, arterial supply, cystic artery, branch of right hepatic artery, venous drainage, cystic vein, portal vein, nerve supply, parasympathetic vagus nerve stimulate contractions, sympathetic fibers inhibit contractions, hormonal control, cholecystokinin CCK stimulate bile releases, physiology of the gallbladder, storage of bile. The liver continuously produce bile 800 to 1000 ml per day. When the small intestine is empty, the sphincter of Oddi at the bile duct opening is closed, so bile backs up into the gallbladder for storage. Concentrate of bile. The gallbladder absorb water and electrolytes from stored bile, making 5 to 10 times more concentrate. Concentrated bile is more effective in fat digestion. Ejections of bile. When fatty food enter into the duodenum, the hormone cholecystokinin is released from the intestinal wall. CCK causes gallbladder concentrations, relaxations of the sphincter of Oddi. Bile is the released into the duodenum. Functions of bile digestions. Bile is not an enzyme, but it aids digestions by emulsified fat, breaking large fat globules into the small droplets, facilitating the action of pancreatic lipase, helping absorb fat soluble vitamin A, D, E, K, excreting bilirubin into cholesterol from the body. Clinical significance: gallstones, cholelithiasis, solid deposit that can block bile flow, cholecystitis, inflammations of the gallbladder, jaundice may occur, bile ducts are blocked. Then surgical removal, gallbladder can be removed, cholecystectomy, bile then flows directly from the liver intestine. Anatomy physiology of the pancreas. The pancreas is a soft, elongated accessory digestive gland that plays a dual role. Exocrine glands secrete digestive enzymes into the intestine. Endocrine glands secretes hormones, insulin, glucagon into the blood. It is vital for digestion and blood sugar regulation. Location: lies behind the stomach across the back of the abdomen. Extend from the duodenum right side to the spleen left side, about 15 to 20 centimeter long. Parts: head fit into the curve of the duodenum. Neck connects the head and body. Body extend across the midline of the abdomen, touch the spleen. So this is the structures, that is pancreas. This is the pancreas. Duct system: main pancreatic duct of Wirsung runs the length of the pancreas and join the common bile duct to open into the duodenum at the ampulla of Vater. Accessory pancreatic duct of Santorini may open separately into the duodenum. So this is the structure. This one is pancreas, this is splenic artery, this is pancreatic isolate. Then after that this is pancreatic isolate, that is alpha, beta, exocrine, acinis. Another is bile duct, common bile duct. This is the duodenum of a small intestine, that is pancreatic duct, and acini cells secrete digestive enzyme. Blood supply, arterial supply from branches of the splenic artery, superior and inferior, pancreaticoduodenal arteries, venous drainage into the portal vein. So this is the aorta, celiac trunk, splenic artery. This is the pancreatic magna artery. This one is the dorsal pancreatic artery. This is the anastomotic branch. Then after that, this is the gastroduodenal artery, anterior superior pancreaticoduodenal artery, posterior superior pancreaticoduodenal artery. This is the anterior inferior pancreaticoduodenal artery. This is the posterior inferior pancreaticoduodenal artery. So this one is superior mesenteric artery. So this is the blood flow. Now nerve supply, parasympathetic stimulate secretion, sympathetic fiber inhibit secretions. Physiology of the pancreas, exocrine functions, that is digestive role. Structure, the exocrine parts consist of acini cluster of secretory cells that produce pancreatic juice. Secretions are carried by ducts to the duodenum. Pancreatic juice produce 1 to 1.5 liter per day. Compositions, water, bicarbonate ions and enzymes. Amylase break starch into the maltase, lipase break fats into the fatty acid and glycerol, trypsins and that is chymotrypsins break protein into the peptides, carboxypeptidase break peptidase into the amino acid, nucleus digest DNA and RNA. Bicarbonate ions neutralize acidic chyme from the stomach, maintain pH 8 into the duodenum. Secretions is controlled by the hormones. Secretine stimulate bicarbonate secretions. Cholecystokinin stimulate enzyme secretions. Endocrine functions, hormonal roles. The endocrine portions consist of the called isolates of Langerhans, that is 1 million isolates, that is alpha that is glucagon, raise blood glucose, stimulate glycogen breakdown in liver. Beta insulin lowers blood glucose, promote glucose uptake by cells. Delta somatostatin, that is inhibit secretions of both insulins and glucagon. Then PP, that is F cells, pancreatic polypeptide, that is regulate pancreatic secretions and digestive functions. Clinical significance, pancreas, inflammation of the pancreas due to enzyme leakage, diabetes mellitus caused by insulin deficiency or resistance. Pancreatic cancer can block bile duct and causes jaundice. Anatomy and physiology of the teeth. Definition: teeth are hard calcified structures located in the oral cavity, mouth. They are embedded in the alveolar socket of the maxilla, that is upper jaw, and mandible, lower jaw. Their main functions to cut, tear and grind food during the process of the mastication, that is chewing. Parts of the tooth. Each tooth has three main parts: crown, the visible part above the gum line covered by enamel and the hardest substance in the body. Shear varies depending on the tooth type, incisor, canine and molar. Neck, the slightly constructed area between the crown and root covered by, that is, cemento enamel junction, that is CEG. Root, the part embedded in the alveolar bone covered by cementum and anchored by the periodontal ligament. Now, internal structure of the tooth, that is enamel, outer layer made mostly of calcium phosphate, very hard and non-living, protects tooth from wear and acid. Dentin, that is beneath enamel, yellowish and less hard, form the bulk of tooth, transmit sensation to pulp. Pulp, soft inner tissue containing blood vessels, lymph vessels and nerve, nourish the tooth. Cementum, bone-like layer covering the root, helps anchor the tooth to the jawbone. Periodontal ligaments, connective tissue fibers that attach cementum to the alveolar bone, providing support and slight movement. So this is the structure, that is enamel, dentine, pulp, gum, cementum, root canal, root of opening, this is the crown, this is the root. Types of teeth. Human are heterodonts, meaning they have different types of teeth for different function. For example, incisors, that is 8, 4 upper or 4 lower, for cutting food. Canines 4, tearing the foods. Premolars 8, crushing and grinding foods. Molars, that is 12, including 4 wisdom teeth, grinding food. So milk, that is deciduous milk teeth, is 20 and permanent teeth will be 32. So this is the central incisors, this is lateral incisors, then this is the first premolar, this is also first molar, and this is the third molar, this is second molar, this one is second molar, this is the canine. So these are the structure and different types of teeth. So physiology functions of the teeth, that is mastication, chewing. Teeth break down food into smaller pieces, increase the surface area for enzymes to act. Then speech, teeth helps to articulations of certain sounds, for example T, D, S. Another is aesthetics, teeth maintain the facial structures and appearance. Digestions, mechanical digestions begin in the mouth, teeth works with saliva to start food breakdown. Protections, and enamel protects internal tissues of the tooth from mechanical and chemical injury. Blood and nerve supply, blood supply branches of maxillary artery, supply upper teeth, inferior alveolar artery, supply lower teeth. Nerve supply upper teeth, maxillary branch of the trigeminal nerves, that is cranial nerves, that is V2. Lower teeth, mandibular branch of the trigeminal nerve, that is cranial nerve, V3. Tooth development, that is odontogenesis, begins around 6 weeks of embryonic life, formed from ectoderm, that is enamel, and mesoderm, that is dentine, pulp, and cementum. Erupts twice, primarily teeth 6 months to 2.5 years, permanent teeth, that is 6 to 25 years. Anatomy and physiology of the tongue. Definition: tongue is the muscles organs located on the floor of the mouth. It is covered with mucous membrane and plays important roles in taste, speech, chewing, and swallowing. So, parts of the tongue, that is apex tip, the front pointed and help in licking and speech. Body, the main central portion. Root, the posterior part attached to the hyoid bone and mandible. Dorsum. Dorsum is upper surface, rough surface containing taste buds and papillae. Ventral surface, that is underside of tongue, smooth and attached to the floor of the mouth by frenulum linguae. So this is the structure, that is epiglottis, that is linguae tonsils, this is palatine tonsil, this is velvet papillae, this is foliate papillae, and this is the fusiform papillae. This is the structure. Muscles of the tongue. The tongue contains intrinsic and extrinsic muscles. Intrinsic muscles located entry with the tongue. Functions change the shape of the tongue: flattening, curling, lengthening. Includes superior longitudinal, inferior longitudinal, transverse, vertical muscles. Extrinsic muscles originate outside of and insert into the tongue. Functions change the positions of the tongue. For example, protrude, retract, move side to side. Include, that is genioglossus, protrude tongues, that is hyoglossus, that is depressed tongue, styloglossus, retracts tongues, platoglossus, elevate the back of tongue. So this is the extrinsic muscles, that is platoglossus, styloglossus, that is hyoglossus, and genioglossus. This is the types of intrinsic muscles, that is superior longitudinal, vertical, transverse, inferior longitudinal, and septum. Papillary surface projections. Filiform, that is thread like, most numerous, provide roughness to taste buds. Fusiform, mushroom shaped, contain few taste buds. Another is that is circumvalent. Another is vallet. Another word is vallet. That is large, arranged in V shape at back, contain many taste bud. Foliate, that is leaf-like on lateral edge. Taste bud in children, less in adults. Taste bud, specialized sensory structures located mainly on papillae. Each taste bud contain gustatory taste receptors cells. Detect 5 basic taste sensations: sweet, sour, salty, bitter, and that is umami, that is savory. So this is the area, different area. This area, this area, it is for bitterness, and this area of tongue is for sour. This one is for salty. This area of the tongue, it is for sweetness. This area of tongue is salty, and this is sour. So these are the specific area for different taste. Blood supply and nerve supply. Blood supply, lingual artery, branch of external carotid artery. Nerve supply, that is motor movement, hypoglossal nerves, cranial nerves, that is 12th. Then test, anterior 2/3, that is chorda tympani branch of facial nerves, that is cranial nerves 7. Test, that is glossopharyngeal nerves, cranial nerves 9. Test for epiglottis, that is vagus nerves, cranial nerve 10. General sensations, anterior, that is 2/3, lingual nerves, branch of mandibular nerves, that is cranial nerves, that is V3. So this is the choroida tympani form. These are the nerves, lingual nerves. Then another is, this one is glossopharyngeal nerves. This is hypoglossal nerves, occipital arteries. Another, this one is hypoglossus. This is deep lingual vein, dorsal lingual vein, lingual arteries, common carotid arteries, internal jugular veins, and that is a sternocleidomastoid branch of occipital artery. So this is the nerve supply. Physiology of the tongue. Physiology of the tongue, that is taste. Taste buds detect chemical in the food and send signal to the brain through cranial nerves. Mastication, chewing, tongue moves food between teeth for grinding and mixing with saliva. Swallowing helps push food backward into the pharynx. Speech, that is articulation, assists in pronunciations of word and sounds. Another is cleansing, remove food particles and debris from teeth and oral cavity. Clinical notes, that is glossitis, inflammation of the tongue. Another is ankylosing, that is tongue tie, short frenulum restrict movement. Loss of taste can occur due to nerve damage or infection. So thank you. Please like and subscribe my channel.